Great. Thank you very much, Kumanan. Thank you to the Alliance for organising and hosting this event. Thank you to those of you in the room, and thank you to those of you online. It's a real privilege to have an opportunity to reflect on this field. And I want to start by being reflexive as a good HPSR practitioner. I want to acknowledge the privilege of reflection at a time of challenge, stress, contestation, and yet was not the world ever thus. I want to acknowledge that the reflections I'll present are absolutely my own reflections, rooted in my own experience, my own understanding of the world, my own understanding of action. I came into the field, and I feel I've grown with the field, from a development studies background, and a natural inclination to see patterns and trends, systems, if you like, in the world around me, as well as a deep curiosity around the politics of social change. And for me, research is political. It must be linked to action to contribute to the task of bringing about social change. So in these reflections, I want to start by looking a little bit at the foundations of HPSR, think a little bit about its evolution over time, and then look forward. So to begin with, let's remember the definition that is established of this field, and I've highlighted in red the words that I think are particularly important. It's about how societies organize themselves in achieving collective health goals. It is, in essence, about collective health action. It developed in its early days, or out of the history of the debates around comprehensive versus primary healthcare, for those who remember those debates. It developed as countries responded to the challenges of structural adjustment programs. It developed as challenges in meeting the Millennium Development Goals led to an emphasis on the need for systems. And that background is important to remember. And it emerged then to support a systems-led approach to strengthening the healthcare platform, and an integrated approach that recognized the horizontal supports needed in a healthcare system. But it also emerged to support a strengthened focus on health over healthcare in system development, and in recognizing that health systems are themselves spaces for action towards social justice and health equity. It recognizes that health itself is political, as are the processes of policy and system change, and that health research of all sorts should be driven from the countries in which that research is located to address local needs. This slide, which some of you may recall, locates HPSR in the broader terrain of health research, recognizing that it has a population level focus, a systems level focus. It embraces aspects of clinical and behavioral research, and critically it draws in social science lenses and perspectives to understanding the experience of health policy and systems. It has a macro level addressing national and global frameworks or needs and demands, a meso level focused on organizational and local level, and the micro, the person in the system. There are a range of related areas of research, and there are many names out there for different types of science that are related, and I would say could fit under the umbrella of health policy and systems. And over on the right, you'll see that I've put the 2012 HPSR strategy of WHO, Changing Mindsets, to remind us that it is a field of action. That strategy says HPSR should be the GPS of decision-making. So how has it evolved over the years? What have been some of the key developments in the field? So on this slide, in the blue book, I've tried to identify some of the key steps in the evolution of the field, from the foundation of the Alliance in 1997 through to the first global symposium in 2010 in Montreux, and subsequently the formation of Health Systems Global. There have been many steps of development. And in the pink box, looking only at the Alliance's own flagship publications, critical products, I've highlighted that the field is really consolidated, has developed. There's a body of work thinking about what HPSR is. There's a range of other products that take forward conceptual development around the field. And then there is the work that focuses on how to do HPSR for the researchers, for the evidence synthesizers, and also for the practice world, that we need to think about collaboration as a part of how we do HPSR. But of course, there have also been challenges and limits, and I want to reflect on them. Challenges derived from contexts that do not always value or appreciate HPSR, where epistemic injustice occurs. Challenges of valuing the field, of setting priorities for it, and of funding it, to be honest. Challenges that continue today. In terms of our research focus, I think we've not done so well actually on the P in HPSR, even though it is there. And there's been some stagnation, I would argue, of the systems lens that was very much a part of the field, but that we haven't further developed as much as we could. It amazes me that in a system that is comprised of people, we perhaps have not done all that we should have done to think about the many facets of human resources for health, development, and management. And the equity focus of our work is sometimes more implicit than explicit. And we continue to have a dominant healthcare rather than health focus. In terms of capability, we've also had a field that has been dominated by researchers rather than our colleagues and allies and co-creators in the broader practice world. And often it's been dominated by researchers based in higher income countries. It can be a fragmented field. There are multiple smaller groups within it, and there is this fragmentation between the research and the policy and practice world. And developing critical masses of those in countries responsible and doing embedded HPSR, that's still a challenge that we have to confront. There are few such critical masses. And as everybody knows, I'm passionate about education, and notwithstanding what we've done, there is much more to be done in developing educational capacity around HPSR. So this is a very changed world. It's a confusing world. Some would say it's a Barney world. We used to be VUCA, now we're Barney. Does HPSR still matter in this world? Well, no surprise that I say resoundingly yes. First, because the drivers of its emergence remain ever more relevant. Collective action for social justice matters. It always matters. We need to do all we can to support that. I also think that many of the HPSR focal areas are of enduring relevance, and I'll come back to that. And whilst we've established some footings for the field, for sure, those footings are in place to be built on. We need to continue the work of developing and reimagining the field moving forward. When I think about the variety of new challenges facing health systems globally, there are many things we can think about, from climate change to AI, social media, responding to the challenge of NCDs. And of course, they're not all listed here. But when I look at those challenges, what I see is that they focus attention on some of the enduring challenges of health system development everywhere. We need to strengthen and understand forms of governance. We need to strengthen system leadership, leadership of and for the system. We need to continue to evolve policy and regulatory frameworks, build resilient and responsive systems, support innovation, definitely focus on service delivery transformation. And we need to continue to work to understand and develop global action and solidarity in support of the enduring challenges and addressing the new challenges. So looking forward, what sorts of things could we be thinking about for HPSR? And remember that I'm, as I've already said, presenting some personal reflections, the things that I feel matter for the field moving forward, but others will have different views, and all views are welcome. I want to present 3 ideas. The first comes back to the P in HPSR and the need to recognize that the research that we do around the P, it matters because it helps to think about how to navigate the politics of health itself and health system development more generally. So what sort of P work can we do? So we're already doing, and we recognize the need for a focus on the political economy of various forces that shape health, health systems, health challenges, and health systems themselves. And they are global forces, and they are national forces, and they are local forces. But I would argue we don't only need to do that. Political economy of those issues is very important. But I would also suggest that we need to focus attention more as a field on political and organizational analysis that addresses the politicization and weakening of the public sector and regulatory bodies as the core groups that should be coordinating a collective response to health challenge. We need also to be thinking about the routine, centrally directed organizing processes of every system that influence collective practice, from public financial management to human resource management and supply chain management, for example. And thirdly, we need to think about how to navigate the organizational phenomena that really do directly impact on collective practice at the front line, at the local level. Phenomena like governance structures, but equally organizational cultures that shape professional barriers and the ability to work across those barriers. Secondly, I think that we need to do more to think about and support the emergence of resilient human learning systems for population health and well-being, strengthening local level learning networks, addressing local level health needs, engaging multiple forms of knowledge workers. And on this slide, I've tried to emphasize that in that task of strengthening local health systems, it's certainly important that we think about service transformation and quality improvement in healthcare. But really, we also have to, even to do that work, we also have to think about strengthening the organizational and multi-level system capability that enables service transformation. And critically, we need to think about the organizational and multi-level capability that supports local level networking. And on this side, I've called this whole system transformation. And I judge that it is rooted in cycles and processes of local level action learning in which researchers have an important role to play, but for which researchers are not the only knowledge workers, because people who work in the system and use the system have the most valuable knowledge. Thirdly, it's absolutely essential that we strengthen and focus our work on health equity and social justice within HPSR. It's part of our being and part of our essence. At this time, as like no other, we need to deepen this work. There is work to be done in measuring and assessing various forms of inequity to focus attention on the need for decision-making that promotes equity. But we also need to support equity-focused action by co-creating, sustaining spaces for voice and collective power in local networks, through local networks. And as researchers, we need to express allyship rather than drivership, if you like. And we have much to learn from the existing experience of so many communities who have sought to do this over the years. So then let me turn, lastly, to thinking a little bit about strengthening HPSR capability. And the points I want to raise are very much in line with the types of focal areas for HPSR that I've already identified. Certainly, as researchers, we always do need to think about our research approaches. And in this field, I think we need to re-energize our work to develop context-aware and sensitive learning and action. There are a range of participatory processes in which many people have been involved. We need to bring that different experience together to learn from it, to deepen it, to develop theory through the practice of learning and action, to apply existing theory to that practice. And I feel we need to start looking much more outside the health literature for the sorts of theory and experiences that can guide us in this work. And let's all be more reflective as we work in the field. We come from different knowledge bases, all of us. We must act as boundary spanners to bridge the various knowledge bases to strengthen the field. And lastly then, at a local and a national level, I think it's really important to come back to that idea of critical masses of embedded HPSR, collectives or communities of practice that cut across the boundaries of research and practice, of public sector and private sector and civil society, and to develop those collectives of those communities of practice. Educational system, health system interface is very important in this regard, because it is in part through the educational interventions that we can develop those with the skills, competencies, mindsets to work in all parts of that field. And at a global level, talking to the Alliance, talking to Health Systems Global, I think that there remains and is important space for proactively, deliberately, purposefully, curating spaces of debate and dialogue across the linked communities of researchers, and most critically, between research, practice, policy making, civil society, to deepen the ideas, the practices, and the action, so that the future is a better place than where we are currently. Thank you very much.